had to have Dr. Aimee back on the channel because there was just so much information that these questions people kept coming up with. And I'm just so happy to have you on. You are just a wealth of knowledge. Thank you so much.
Oh my gosh, Maria, I love being here and I love answering people's questions around thyroid and hormones. I mean, that's what empowers people. So they got to get their answers. Yeah.
How did you become this thyroid expert? Because you know stuff that I've never heard before.
It's deep diving from your own pain. It's because I, like many of the listeners, I was misdiagnosed 6 times. I mean, 6 different doctors told me you're normal. It's all fine. Your labs look good. There's no problem. So you literally start thinking to yourself, you're like, oh my gosh, there's nothing wrong with me, but there is. Right. Okay. So it must be my fault. Maybe I need to restrict more. Maybe I need to exercise more. Maybe I need to do this detox and this diet plan and this protocol. And you end up wasting so much time and money on these stupid things that don't work because basically you've been medically gaslit. Like your doctor has led you to think that you're crazy. And so you do all this other stuff hoping that maybe something will work to make you feel better. And it doesn't. So I was there. I mean, I was just like the listeners. I was right there in their shoes. So I know how important this information is. And I know how beautifully nuanced our thyroid and hormone balance is. So without the right information, people can get it wrong.
As you know, we love Hawaii. It's quite warm here, though, for me especially. I don't do as well with the heat, so I need to stay really well hydrated. And one of the great things about the new Element little cans that have a little different amount of electrolytes and citric acid, and it's a different flavor. And actually not a big fan of the orange in the packets. I really love it in this new sparkling product. So we like packing these, and when we go on hikes, we just did a long hike up to a huge waterfall. Got some great family photos that we'll share. But this is really helpful right now because I'm needing it because it was a pretty rough hike up these rainforests. So if you want to get a free sample pack with your order, go to drinkelement.com/Keto Maria and you'll get a free sample pack and maybe try out these new sparkling products.
What are some of the things, the ailments that people could be experiencing that they don't even know is caused by thyroid issues?
Yeah. It's a lot. It's a lot. So the big ones are, weight gain or just the inability to lose weight. They're doing all the things. They could be doing carnivore. They could be doing keto, and literally the scale's not moving. And they're like, oh my gosh, what else can I do at this point? Extreme fatigue, hair loss, hair breaking, hair thinning, constipation, brain fog, anxiety and depression. And then some other kind of wacky symptoms that a lot of people don't correlate, but that are related to thyroid: frozen shoulder, joint pain, really dry, cracked elbows and feet, super dry skin, loss of the outer corners of your eyebrows, a swollen throat, hoarseness in your throat. You're always clearing your throat. Or if you can actually feel swelling going on in your throat, sometimes you can feel the nodules on your thyroid. You're cold all the time where everyone else around you is totally comfortable. Night sweats, insomnia, lack of motivation, loss of libido. All of those things kind of go in the same bucket. It's the thyroid and hormone bucket that once we optimize your thyroid and your hormones, all of those symptoms improve or totally disappear. And that's the confusing part, because that's where a lot of people will do what I just said. They'll be like, well, I'll buy this supplement and I'll do this gut healing protocol and I'll do an adrenal protocol. And this person told me that the reason I feel this way is because of my cortisol. So I'll do that. And they're doing 10 different things. And it's like, just fix your thyroid and hormones. Yeah. That's all. And everything, your adrenals will be happy. Your insulin will be happy. The rest of your body will be happy. And you won't need to spend all this money on all these different programs that they're addressing the downstream. We need to address the upstream that affects the downstream. So you fix the thyroid and hormones. Yeah.
That makes so much sense. Wow. Why do most doctors get it wrong? Like when they just prescribe Synthroid or levothyroxine and people don't feel better. Why is that? Tell people.
Well, unfortunately, it's standard of care. So your doctor, I mean, believe it or not, your doctor isn't set out to
Right.
piss you off or frustrate you, right? But they do only have 5 to 7 minutes with you. Insurance is very, very strict. You got to get in, you got to get out, and you can only address what is seen as flagged on your labs. So it has to have an H or an L, like a high or a low. It's got to be red in order for your doctor to pause and be like, Maria, this is a problem. Let's discuss it. If it's not flagged, then they don't have the time to stop. The other thing with thyroid, especially, well, with thyroid, they've been taught you test one marker, TSH. If that's off, if it's flagged high, you give T4, and that is it. That's standard of care for thyroid treatment. Hormones, doctors are still believing that hormones are dangerous. They cause cancer. Like they haven't even stepped into what we know now in 2026. Hormones are safe. They protect us against cancer. The black box warning has been taken off. The Women's Health Initiative study has been totally destroyed and debunked. But doctors are still living in 1990.
It's so true. It is really true. So when a woman, I loved interviewing you earlier and saying, why should women get on hormones even if they don't have symptoms? Because that is a big issue in this. I will say the carnivore community will say, just eat carnivore, eat high-fat carnivore, eat sticks of butter, and you don't need hormones. And I say, you could be eating the perfect diet in the entire world. You are going to age. Your ovaries are going to stop working, and you should care because arterial stiffening, brain, you tell them.
Yeah, well, you're right. You're on the exact path. The hardening of your arteries, brain inflammation, Alzheimer's, dementia, all tied to low hormone function. So basically, if you think about, let's think about the animals in the wild. All mammals have hormones and they decline as they age. Essentially, when an animal loses their ability to reproduce, i.e. their hormones go away, they die. Because those diseases of aging, whether it's cancer or heart disease, I mean, that happens to animals too. I mean, think about your dog, right? Your dog can die of cancer. Your dog can die of heart disease or cardiovascular issues. Absolutely. And that happens as they lose their hormones. Now, we don't really have hormone replacement for dogs yet, but we do have it for humans. So we get to avoid those diseases of aging.
Yeah, I just think that's such a misconception that you could eat this perfect diet and you won't, I don't know, you won't age, you won't need hormones. And another thing that frustrated me is yesterday someone was reaching out and saying, okay, so I did the labs like you told me to, and my estradiol is less than, they didn't give me a number. The doctor gave me less than 40.
Yeah.
And she's in the normal range for a postmenopausal woman. I was like, yeah, that's for, you want to feel like crap the rest of your life? You want to go back to what you were in your 20s and early 30s. Why are we normalizing this postmenopausal number, right?
Oh, I love that you brought this up. That pisses me off more than anything on the labs, where they actually, under hormones, they'll break it down. You know, you'll see luteal phase, follicular phase, and then there's this postmenopausal number, as if like, okay, ladies, once you go through menopause, just give it up. Just throw in the towel. Just accept the fact that you're going to feel like garbage. You're going to get fat. You're going to lose all motivation and zest for life. You're probably going to be bald and you're not going to be able to get off your couch. But that's okay because you're in that postmenopausal normal range. Oh my goodness. That is so wrong. That's basically telling women and their doctors that it's okay if this person shrivels up and dies.
Yep.
Because they are in menopause or they are postmenopausal. Absolutely not. Ladies, I want your numbers on those hormone lab values, specifically estradiol. I want it in like the luteal phase. I want it like you're a beautiful 30-year-old still cycling. That's where we want your estradiol. And we can absolutely get it there. And I don't want you to listen to this and be like, I don't want to have a cycle again. No, you don't have to. even with static dosing of hormones, we can bring your hormones up out of the toilet. So for estradiol, we know that we want that estradiol number 50 nanograms per deciliter or above for you to even just have the bone, brain, breast, and heart protection. Now, where you're going to get symptom relief is when we get it closer to like 100, 120. You're not going to have a cycle, but you are going to feel a ton better, and you're going to have that layer of protection against all those diseases of aging.
Thank you for that. That is such an important thing to know. So I have a lot of questions that I ask my community, and I want to throw some of these out there. Can Hashimoto's be cured completely, or will it always be in remission?
Great question. Okay. So we can put Hashimoto's, which is the autoimmune form of hypothyroidism, we can push those numbers to 0, which is essentially putting autoimmune into remission. But like with any autoimmune condition, whether we're talking Hashimoto's, lupus, MS, Crohn's disease, you never really cure it per se. I'm using air quotes there. You don't cure it. You put it into remission, meaning it's dormant. You're not actively having an autoimmune attack on whatever that gland is. Hashimoto's, obviously, it's a thyroid gland. But what can happen is when a person is, let's say, exposed to a big stressor, maybe a viral load, a viral infection, they get sick, that can kick up that autoimmunity. So it's essentially bringing it from its kind of sleeping, dormant phase into kind of an awake, alert, kind of inflammatory phase. So you never really cure it, but you can push it into remission. And we use things like black cumin seed oil, the prescription low dose naltrexone, that helps to lower antibodies, being gluten-free, going carnivore, that helps to lower antibodies as well.
Well, I like that you said going carnivore. That was a question that I got about. So are you familiar with Dr. Steve Phinney?
No, I'm not. I'll have to look him up.
He's one of the keto pioneers, and he always said, yes, I believe he said T3 may lower when you do a low carb ketogenic diet. However, he says it's making it more efficient. What say you? Does being low carb harm the thyroid, or is it making it more efficient and then the numbers will be lower?
Yeah, I'm going to agree with Doc there. So what happens is you can get a small little drop in your free T3 when you are very, very low carb for a very, very long period of time. However, we don't get overly concerned about that because let's face it, when someone does change over to keto or carnivore, they are lowering inflammation. They're removing foods that can kick up that autoimmune attack if they have Hashimoto's. So just that premise alone, you are creating an environment where your thyroid in and of itself can work better. Now, that still might mean that you need a little bit of thyroid hormone replacement. Maybe we give you a little bit of T3 or natural desiccated thyroid. But what you're doing by going keto or carnivore is you're building a beautiful foundation for the hormones to kind of come into and work so much better. I mean, if you think about it, if we were to start treating someone for low thyroid function, and let's say they're in menopause and they need hormones too, and they're going to McDonald's every day, everything in their pantry is boxed or canned, they're eating very low protein. I mean, do you really think that the thyroid medication, the thyroid hormone, and the beautiful bioidentical hormones are going to work when the foundation is basically a dumpster fire? Like when we have a beautiful, flourishing, clean out foundation, then the hormones can come in. They're like, yeah, I can do my job now. I can give this person a metabolism. I can light up their brain. I can make them feel so much better so quickly, as opposed to hormones coming in and trying to work their way through inflammation and high insulin and glucose spiking left and right. It's just not going to work.
I believe you coined the term thyroid pause. Was that
Thyroid
you?
pause. Yeah.
So
yeah.
what exactly is going on? I mean, people always seem to gain weight during menopause, or their body composition changes. What is going on?
Yes, yes. Thyropause. Okay. So here's my argument, ladies. You know, we have a lot of focus right now on perimenopause and menopause. There's so many books out, so many, but we're not focused on the driver of perimenopause and menopause, and that's your thyroid. So what happens during thyropause is essentially when we enter perimenopause, we know that progesterone is really the first hormone to tank. And then that's followed by testosterone. And then what your estradiol will do is it'll go on a roller coaster for a little while, and then it'll fall off a cliff when you're officially headed into or in menopause. I know menopause is so confusing because it's like, it's just a moment in time when you've gone 12 months without, 12 months without a cycle. But essentially when you're in that perimenopause state, your hormones are on a wild roller coaster ride. And what that does is it creates a stressor in the body, which flips on a Hashimoto's switch. So that switch for Hashimoto's can be in the off position for years, if not decades. Then a woman goes through perimenopause and it's like, boop, that switch turns on. Now she has thyroid issues in addition to hormone issues. So that's where we just need to look at and address both. Because so many times, and I'm sure you see this, Maria, all the time in your community, people will go to these pop-up hormone clinics or these, online $129 a month, get all your hormones in a cream and we'll ship it right to your door. Okay, fantastic, but nobody's looking at their thyroid and no one's really customizing their protocol to them. So that's where we're failing women with these one-size-fits-all protocols, because it can't be one size fits all. Some women are going to have thyroid issues as they enter perimenopause.
Yeah. I mistakenly did that. And what I'm most frustrated with is they talked to me zero about vaginal estrogen. And I think that is one of the first things you should go on to save you from bladder issues, from vaginal atrophy. I mean, I was shocked when the actual doctor I went to that was a hormone specialist was like, why are you not on vaginal estrogen? I was like, I don't even know what that is.
Yeah, I know. It really, I've seen a lot of the behind the scenes of these online pop-up telehealth clinics. And it's an algorithm. It's basically, you are an algorithm. And my argument is, we are not numbers. We are not algorithms. We are human beings. And every single woman is so unique and so different. So just like you said, one woman might need vaginal estrogen in perimenopause. She doesn't need the patch yet. She doesn't need a cream. We don't need to jack her estradiol up because it's already in the hundreds, but she is experiencing that dryness. She's getting a few UTIs here and there. The intercourse is starting to be a little bit painful. Let's start with the vaginal estrogen, but your pop-up clinic isn't going to do that. They're going to put everyone on the same thing.
Well, even that like frequent urination at night, that should not happen. That's low vaginal estrogen, right?
Yep, exactly.
So let's see. What are the root causes of thyroid issues? Is it tied to processed food, insulin resistance? It seems to be very common. Have become very common.
I love this question too. I actually specifically address that question in my book, The Thyroid Fix. So here's how I address it. I say, a lot of people ask me, what's the root cause of my thyroid condition? And I answer them with, your thyroid is the root cause. So if you think about it, what causes thyroid disorder, hypothyroidism? Well, it could be a variety of different things. Number one, Epstein-Barr virus is a big one, which pretty much 99.99999% of us have. I have not tested a single individual who doesn't come up positive for EBV. So it's like one of those things where we all have it. I mean, we all had mono at some point in time in our life, unless you grew up in a bubble. So EBV is one. Stress is another one. And again, it's kind of what we talked about with thyropause. What is going to flip on that Hashimoto switch? So 95% of all hypothyroidism is autoimmune. So we look at, all right, what are the causes of autoimmune? Epstein-Barr virus, stress, you have to have leaky gut, a trigger. So yeah, eating garbage, processed foods, that's going to exacerbate the situation and maybe bring it on sooner. But when we're looking at the root cause, quote unquote, of hypothyroidism, it really is like the thyroid is the root cause. The thyroid is the root cause of why you can't gain weight, of why you have depression, of why you have heart palpitations, of why you have blood pressure issues and cholesterol issues and blood sugar issues. Like the thyroid is really the root cause of many other things.
Wow. Have you heard that, how you were saying how estrogen can go really high, really low during perimenopause, that when it's very high, that's when autoimmune disease can be triggered?
Yes, exactly. Well, high or low. It's just the roller coaster. It's the fluctuating hormones. So we often see Hashimoto's come on even after pregnancy. So what do we know during pregnancy? Your progesterone is surging to a level where you don't ever experience that level any other point of time in your life. Progesterone surges, estrogen goes up and down, so it's a hormonal roller coaster. Same thing happens in perimenopause. So that hormonal roller coaster, even though it's a natural occurrence, to get pregnant, have a baby, whatever, it's a natural occurrence to go through perimenopause, even though we really don't have to suffer.
Right.
Those hormonal fluctuations are stressors enough to basically bring on an autoimmune condition, bring on Hashimoto's.
Well, that's good to know. Someone asked, I was diagnosed with Graves' disease. Naturopaths seem to recommend iodine, where endocrinologists seem to avoid it. What is Dr. Aimee's opinion?
So with Graves' disease, it's much more rare. So Graves is the hyperthyroid version of autoimmunity. So Hashimoto's is hypo, Graves is hyper. And with Graves' disease, we tend to tell people to avoid iodine or just use a small amount. So this is where I really love liquid iodine, and I like the nascent iodine version because it's much more gentle. And someone with Graves might use 1, maybe 2 drops a day. That way you're still getting in that vital element, that vital nutrient, but you're not going so high, like you're not using the same doses that we would use in someone with Hashimoto's or hypothyroidism.
What about using it topically? I know a lot of people will put it on their thyroid gland rather than ingesting it.
Waste of time. It's not.
Good
it's not.
Know.
Yeah.
Good to know. I know a whole bunch of people that do that, and I'm going to be like, Dr. Aimee says it's a waste of time.
Just take it orally. I mean, if you have it in the liquid, why turn your skin orange? Just put it in a little bit of water and slam it down.
Yeah. I do it like a shot.
Yep.
So when it comes to iodine, it's beneficial for breast cancer, right? It's beneficial for radiation. It's beneficial for a lot of things other than your thyroid, right?
Bingo. Yes. So iodine is a master detox element. And basically what happens is when we're exposed to fluoride, which is in our water system, bromide, chlorine, which we're exposed to every single day, those toxic halides will compete at our receptor sites on our cells with iodine. So basically, if we don't have enough iodine, the toxins are winning. So absolutely, I believe everybody needs some iodine, even the Graves patients. Like I said, drop or 2, everybody needs iodine in their life because it is so vital at protecting your body. It's antiviral, antibacterial, it boosts your immune system, protects against cancer. It literally turns on a gene called the p53 gene, which is a tumor suppressor gene. So it's going out, and if you have a cancer cell that's starting to get a little bit wonky and wants to change and wants to multiply, the p53 gene will come in and suppress that tumor growth. And that's what iodine does, is it increases that p53 gene.
Well, it is found that everybody has cancer. It just depends on if it turns on or off, right?
Bingo. Yeah, we all have cancerous cells, but luckily we have an immune system that goes on surveillance. for those wonky cells. And most of the time, our bodies are killing off those cancer cells before they can turn and become a problem. And that's where iodine gives us kind of an extra edge.
When I was in Korea, I brought my liquid iodine, but that dropper inside is glass and it shattered. And so I was like, oh man, I can't take any of this because the little shards of glass are everywhere. So I went to every single pharmacy asking for iodine, and they don't have it, but I believe it's because their diet is filled with foods with iodine.
That is true. That is true. Yeah. So just being over there, you probably got enough iodine. Now, for us over here in America, I always say just take a supplement, because you really have to be careful of the sources. Like if you were going to rely on, let's say, kelp or seaweed, what are the sources? Do they have heavy metals in them? Are they being sourced from, a water system that's polluted? So we just don't know.
Right. Someone asked, will I ever be able to get off meds?
Maybe. So maybe. So here's the thing. There's a two-part answer to that. Whenever I hear someone ask, will I ever be able to get off my thyroid medication? It's usually because they're not on the right kind or the right combination for them to actually bring them relief of symptoms and a higher quality of life. So if that person asking the question is on T4 only, Synthroid, Levo, or even if they're just on natural desiccated thyroid, that doesn't work for everyone. So if they're on the wrong thyroid med, then yeah, you're going to be asking, oh my gosh, can I get off of these? It's not doing anything anyways. Yeah. But I promise you, if you are on the right combination for your body that works for you, that brings you out of that hypo state, that turns on that metabolism, lights up your brain, increases your quality of life, where you are literally living in optimization land, where life is good and you're energized and you're not gaining weight looking sideways at a brownie, you're not going to want to go off that thyroid medication, that thyroid hormone anymore. You're going to be like me, and you're going to say, you are going to have to pry this out of my dead cold hands to take this away from me, because it does so much. So it really is about being on the right combo for you.
So with that said, I think we should tell everybody what we have planned, because I want people to find out what their right protocol is, because let's be honest, your doctor's not going to tell you this.
No.
No. Is. So let's tell them what we have planned for everybody.
Oh yeah, we have something juicy. So we have a live thyroid and hormone strategy session that is going to help you fix your thyroid, fix your hormones, and fix your life. So what we're going to do is we are opening this up. I'm just doing this for your people only, Maria. We're opening it up. What did we decide on? We decided on, let me find the date so we can give everybody the exact date and time.
We did not
locked in
just yet.
Let's see here. I know we have it in here.
I don't think we actually picked out a date.
Oh, did we not pick out a date and time? So we need to do that.
And we'll have all that information below, and I will make sure to message, and you can throw a comment down here. If you don't see it, throw a comment in the comments, and I will give you the link and the date and the time, because we want you to be live so we can answer your specific questions. Because what I'm so excited about this is that, you're only one person. You can't help the entire world just by, having meetings with them, consultations with them. But this type of a thing, you could actually teach them how to read their labs properly and what medications they should get on so they feel amazing.
Bingo. Absolutely.
That's what we're doing.
We're doing it. So yeah, we'll pick the date and time. Maria will pop that into the show notes or the comments, whatever they call it these days.
You have to sign up. You have to sign up.
You got to click the link and register, because here's the thing. And I'm just being real. I have registered for so many things that I've really wanted to go to. I mean, literally like with my favorite people. And then ultimately an hour after that thing starts, I'll look at my phone. Damn it, I just missed it. So unless you register, you're not going to get the reminders. Like we will send out, we don't blast you, but we're going to send out email reminders so that you can literally be on the call live. And that's where the magic happens. When
Right.
you can literally sit there with us, go through your labs, look at the ranges, like hear me talk and me be able to answer your question live, that's where you are going to get movement in your symptoms, in your life, and how you feel.
Yep. So I'm very excited about this. And with that, I'm going to keep all the rest of the questions for that live webinar, because
I love it.
you know, that's just going to be life-changing for people. So I really think they should consider doing this. And will they be able to get the recording after they, you know, if they also do the live webinar, will they get the recording?
Yeah. So make sure that you register, because that's the only way you're going to get the replay too. So
Yep.
make sure you register, really try to be on live. But if you can't, I totally understand. We will be sending out the replay, but obviously you won't get your question answered live on the replay. So try to make it live, put a reminder in your phone, even if you pop it in your ears, you're driving around, taking the kids to practice or whatever.
All the time.
You know, try to be on live, because that's where you're going to get the attention.
Yep. Well, awesome, everybody. So make sure to check the link in the show notes, and yeah, I'll post it all over my group so you can find it there too. Anything else you want to leave us with, Dr. Aimee? I mean, we'll have all of your information below. We'll have your amazing thyroid supplements. You have so many different great supplements for blood sugar, the T2, and you could also just do a consultation with Dr. Aimee if you want to. So we'll have that link below too. But anything you want to leave people with?
You know, just the message of hope. You know, I know that there are women listening to this right now that they think they're a tough case. Everyone has dismissed them. They may have even been the functional medicine practitioners that, you know, they're like, I just don't know what to do here. I promise you that you can get better. I promise you there is hope. I promise you there's an answer. And, you know, the reality is that even functional medicine, unless they specialize in thyroid and hormones, they just don't know. You know, they try, they're throwing darts, but they don't really know what to do with you unless they specialize in that. So please leave your frustration behind. Come to the live strategy session. I want you to have hope that literally things can change, and things can change soon for you.
I love that. Well, thanks again, Dr. Aimee, and we'll see you soon.
Sounds good. Thanks, Maria. Thanks, everyone.
Bye, everybody.